This morning, our keynote speaker is going to address a topic that is for our benefit as healthcare professionals. Job burnout affects much of our society, and healthcare is not immune to this. We are all aware of the difficulties that we're facing trying to deliver high-quality medical care to our population, and we're facing increasing shortages of caregivers. This was recently addressed in our local newspaper, the Press Democrat. The population of our state is stretching our resources significantly. And when you look at how physicians match up with the population, there are large disparities. This is taken from the California licensing activity. So when you submit your renewals for applications, this is where this information comes from. And you can see that even though there's a large number of physicians actively licensed in California, those not in training becomes limited. The Sonoma County Medical Association and the Mendo Lake Medical Association supplied the statistics in yellow, which show the number of physicians active in each county and the breakdown between men and women. One of the surveys that's listed when you renew your license is physician workflow, and I found this interesting. I don't know how this matches up with your workflow, but it seems a little light for my workflow. But basically, you can see that there is a definite contribution in everybody's weekly process that's not involved with patient care. If you look at the county primary care physician to population ratios, it gives you an idea of what's available to deliver adequate health care. And the breakdown is very interesting, and obviously the counties that are of economically a little better off and a little bit more populated, the breakdown tends to be a little bit better if you look at Sonoma and Marin being, of course, at the top of the list. And if you look at the counties that are a little bit more economically challenged, like Lake County, you can see where the disparity is. This, as it turns out, has an extremely large impact. So there's a paper that comes out every year that looks at physician supply and distribution for all the counties in every state in the union. This is the most recent paper that came out for this year for 2018. Now I've just selected a few pages here, and forgive the slides, but the reason that I pointed these out is I just wanted you to take a look at the distribution of physicians according to type of specialty. And you can see that the majority is not in primary care, and that turns out to have some significant impact on how care is delivered and the outcomes. And this is not a new story. We all know this. We've heard this forever, but it's good to see that it gets looked at carefully. Here, if you look, this is a slide that points out gender differences, and then if you go down further, you can notice that the gender differences carry out through all age groups. And this is just to show the facility-based the type of practice that people are involved in, whether it's in a group, if they work for the state or a government health care, or a solo. And the interesting part of this demographic is that in individuals under the age of 40, the great majority are in some type of group practice, whether that be a Kaiser type practice or groups associated with hospitals. The demographic locally, according to our population, you can see that the difference between each of our contiguous counties, again comparing Sonoma, Marin, and Lake, And then the gender breakdown is the same. I found it interesting that Marin had an older demographic than Sonoma County, but again, maybe because of our agricultural industry and there being more manufacturing here and things like that than Marin, the demographic is a little bit younger. The poverty level there's a huge discrepancy. Again, Lake County demonstrates 21% poverty. And if you look at the median income, as you might expect, it follows that pretty directly. So why is this so important? There's a health rank that's put out by the Robert Woods Johnson Foundation every year that looks at, again, all the counties in the United States. And the take-home point on this particular slide, and why I wanted to put it up here, is if you look at the counties that have the lowest primary care physician contingent versus the highest primary care contingent, and then you look at what their rank is in terms of health, and there's a number of metrics that you can see up here that are used for that, and each of those metrics is broken down into further metrics. So it's very detailed, and it's a worthwhile paper to take a look at. It's not that long, and it's very interesting reading. But if you look, Marin County, number 1. Lake County, 58 out of 58. And again, look at the number of primary care physicians, the ratio of physicians. Sonoma County ranks in 8th, and again, number of primary care physicians and the ratio. So, as it turns out, your impact as a healthcare professional is really critical. So, how do you stay in the game? How do you stay in the field? And one of the things that significantly affects that is physician burnout or job burnout. And this is not an isolated topic just to our profession, but certainly crosses across many professions.